Hi guys, it's Dr. Childs here. Please listen to this entire video if you're interested in my hormone and weight loss mastery guide. I'm going to go through this entire program and I'm going to help explain it to you, and it will be the best thing you can do is to listen to this whole video in its entirety. For your information, a lot of what I'm saying here will be in the text below on this page, but this will contain the most amount of information. So the chances are, if you're listening to this video, that you're aware I have a weight loss program, and it's called the Hormone and Weight Loss Mastery Guide, and I want to explain to you exactly what that is, what is included inside this program, and how and if it may be effective for you. So to start off with, we need to talk about who is this for? Who did I design this program for and why? Essentially, in the beginning, I made this program for people who had thyroid issues in mind. But like most things that I do, it's been an evolution, and so I've included multiple changes and iterations into this program over time. So originally it was designed for people with hypothyroidism, Hashimoto's, thyroid resistance, and pretty much anyone with any sort of thyroid imbalance. But I've included other things over time to help not only those people, but to also include people that had or that have other hormone imbalances. And so which hormone imbalances am I talking about? I'm talking about people that fall on the PCOS spectrum. So that's polycystic ovarian syndrome. That would be people who have hormone imbalances such as estrogen dominance or low progesterone. Well, let's go ahead and fix that right here. Low progesterone. And then in addition, people who have insulin resistance, diabetes, or prediabetes. And then of course those with leptin resistance. So the reason that I included all of these in here is because you really don't have one hormone imbalance without multiple others. So it would be irresponsible for me to say this is designed only for those with hypothyroidism and then ignore the rest of the hormones. It doesn't work that way. The body is much more complex than that. So really, this is a weight loss program designed to treat the major hormone imbalances that occur when anyone loses weight. So would this work for you if you were just interested in weight loss? Absolutely. But what it was designed, I want you to know, it was designed originally for those with hypothyroidism, but evolved to include so much more. So let's talk about, or actually, let's just show you some of the before and after pictures. So you know, because one of the questions is, does this work? Like, will this work for me? And I will go over those in detail below. But the answer is most likely, and I'll explain to you some of the scenarios in which it might not work for you as we go. So first of all, this is a before and after picture, and you might look at this and say, well, there's no way that can happen to me. This is too amazing. Like, there's just no way. And when you look at her pictures, I will tell you that this did not occur over like a 2-month period. This represents a 9-month treatment program in which this particular patient went through the program multiple times. And I would be lying to you if I said you could lose 50 plus pounds in 2 months. That's not realistic. And if you did anything that helped you lose that amount of weight in 2 months, I can guarantee that you would gain that weight back eventually. It's not going to be a lasting solution. This program is a lasting solution. It's meant to be used in the way where if you lose 20 pounds, those 20 pounds are gone forever, unless of course, you know, something insanely happens or something crazy that's out of our control occurs to you. But generally speaking, even if you fall off the bandwagon after you lose this weight, it will not come back, okay? And that's the point. So this particular patient went through multiple rounds of this 60-day program, and you can do the same thing too. You don't have to purchase the program again. Once you have the information is yours, and you can repeat it as many times as you want. And I talk about that in the program, how to repeat it. So you can see here, many of you might start over here on the left, and then you might lose 15 or 20 pounds and kind of move over to this second area and get discouraged and slip off the bandwagon or whatever, and then go back over here, right? But in order to get this sort of weight loss and these sort of changes that you see here, you have to continue. You have to be persistent and you have to be dedicated. And using the information in this program will help you get all the way from over here to over here. But it will take time. I'm not going to lie to you and tell you that you're going to do this in 2 months. Like I said, this is a 9-month progression, and that's the kind of time that it takes. Now, what I will tell you also is you can see from this one over here, it almost looks post-surgical because it looks like she might have had like a tummy tuck or something like that. But this isn't. The way that this program is designed is actually designed to help shrink the skin as you lose the weight, and you can actually do that, and that's explained in the program itself. So again, this is a hypothyroid patient. I'll also tell you that this particular patient had radioactive iodine ablation therapy and only had about 30% of her thyroid functioning. So just so you're aware, it works in hypothyroid patients. This is the only patient who didn't actually have hypothyroidism who went through it. But just to show you in 1 month, men, of course, they're way easy to help lose weight. So if you're a guy watching this and you go through it, you're going to lose weight pretty much no matter what. It's just that's just how it goes. So this is the only patient who didn't have hypothyroidism. This is a patient who had hypothyroidism and PCOS. This is a 60-day before and after. You can obviously see the big change there. And again, over here, I think this represents about 20 pounds of weight loss. This one represents, I think, about 18 pounds if I remember correctly. But the point is, somewhere between 15 to 20 pounds for both of these. Again, this is more of a long-term. This patient lost, I believe it was 50 to 55 pounds over the course of 6 months and multiple rounds of it. I think she did it 2 or 3 times, I can't recall, but somewhere around that. This is only about a 6-pound weight loss, but you can see the change in the definition in the medial aspect of the legs, and then obviously the definition around the abdominal kind of cavity. And then lastly, here's another one. This is a 1-year progression picture, and I think it represents 40 to 45 pounds of weight loss total. And then here's another before and after picture. This one is a 60-day period. But again, men, they're a little bit different than women. They just lose weight a lot quicker. But I want you to know that yes, all these people did go through it and had great success with it. So the next question you might have is, what exactly is included? So let's go through that. So first of all, it does include a dietary guide, and in this dietary guide, it has weekly shopping lists and a recipe guide. So it has the recipes and it has the shopping list that you would need. Now, one of the questions I get a lot is, what if I have specific dietary recommendations, or what if I can't eat this, or I can't eat this but I don't like this, or whatever. The truth is, short of having a nutritional coach, going to bat for you and paying somebody a lot of money to specialize your diet, you're not going to find something like this that fits the criteria for every single one of you. So what I've done here is I've created a basic dietary guide, and then I've given you the information inside the program to manipulate that diet to fit your specifications. And I include this information in there. I include how to change it if you have adrenal fatigue, if you have Hashimoto's, if you feel you have autoimmune issues, and so forth. Like I teach you how to change your macros, how to manipulate the percentage of protein that you're eating versus the percentage of carbohydrates versus the percentage of fat based off of these medical conditions. But it doesn't include specifications for every single one in there. It just gives you the information on how to go about doing that. And I want to be very clear about that. Now, the second thing is, and I'm really excited about this, as I said before, this has been an evolution for me, meaning that I've changed this program and I constantly add to it and manipulate it and tweak it over time based off the results that I'm getting from the people that are inside of it. And so one of the things that I've just started to add to it now, which I'm really excited about, is a specific video series that's only going to be available for those people who purchase this program. And this is going to be the information that I've never actually shared on the blog before. And I'm going to go over exactly the videos that I've already made and that are going to be coming out in the future. And I'm going to be putting out one of these a day. So the chances are, if you're watching this today or within the next couple days, most of these videos will be out within probably 10 to 15 days. So and the program lasts well, as long as you want to, but at least 60 days. So this information will be available to you if it isn't already. Now, the third thing is intermittent and prolonged fasting protocols, including variations for those people who need to change it. So again, much like diet, these type of things are not, they need to be individualized. And what I do is I give you options, and then I tell you how to change them to your specifications. And that's what's important. Because again, short of having a nutritional coach there doing this all for you, you're going to have to do some reading, you're going to have to do some work to figure it out. Now, again, that's one of those things where in a perfect world you would have someone tell you exactly what you need, but this isn't that. If you're looking for that, then you need to hire somebody like a health coach or a physician to guide you through this entire process, which is going to be much more expensive, of course. But if you have the ability and the willpower to do it, I'm giving you everything that you need to do it on your own. Fourth on the list is a list of high-quality recommended supplements. Again, these are supplements I don't necessarily share on the blog. These are my favorite supplements, the ones that I use specifically for my personal patients, and the supplements that I think are the best. Now, the supplements are not included in the program. You must purchase those. You're going to have to purchase those through where I show you can get them. Most of them are available on Amazon, some are not, and I tell you which ones, how to get those if they are not. So, but I do want to tell you that those you will need to, I recommend that you purchase them. They're not necessary, and we'll talk about that a little bit later, but they will help boost your results. The next thing is, which is number 5, is a list of recommended medications to augment treatment and boost your results. Now, this program does not include treatment with me, but I do give you all of the necessary information to take to your doctor to get some help if you need it. But again, it's not needed. This program is meant to be used on your own without physician supervision. However, I still feel like I want to provide you with all the information I possibly can to give you this information so that you can, if you have a physician willing to work with you, get even better results. Why wouldn't I do that? But don't confuse that as me being able to treat you, because that's not what this is. Again, if that's what you were looking for, then you're going to have to, that's going to be way more expensive than what we're talking about here. That's just the nature of the beast. The next one is I do give you an exercise guide. Now, a lot of you are getting this wrong, and this is why I had to include all this stuff. The reason is because a lot of you really don't know how to eat, and you really don't know how to exercise, but the sad thing is you've been told that you do. And so what I've done here is I've really actually, busted the lid open and showed you, and we'll show you exactly how to exercise with what frequency based off your body type, and et cetera, et cetera. So again, that's included in there. I talk about all of the science and literary studies, of course. If you've read anything that I do, you know that that's included, kind of as baseline. I also have a frequently asked questions, an FAQ guide that a lot of patients who have asked before have gone through it. So as I've done this, and I've had hundreds go through it at this point. I don't have an exact number, 300 plus though last time I looked. The patients, they tend to have the same questions. So I've gone through and I've taken the liberty to answer those. And again, I'm constantly updating this. But if you have any questions regarding that, of course, send it to me and I can include them into the program. But most questions are answered, and if they're not, then most questions will be answered in this guide. Because again, I've answered the majority of them. After doing this hundreds and hundreds of times, you kind of get the trend of what questions are going to be asked. Another thing is I do include some tips and tricks. So this just more goes along the lines of how I help you individualize this program to you, and that's in the documentation of the program itself, and it's included in there. And then, of course, this kind of goes this goes back to the videos, which we'll go over again. But I do talk about all of the medications. I have the video series that I've mentioned to you, which will go over exactly how to, like, I'm talking about this type of stuff that I've never used before, but we'll talk about this in just a moment, which I believe is next. So the videos which I mentioned, they are in progress, and this is the new addition to this program, which I'm really, really, really excited about, because like I said, I've not shared this information on the blog before. I've contemplated even should I ever put it out there ever, and so I'm deciding to put it into this program. So one video a day will come out of in this, but this is going to be a lot. Like the first video I did has already been like 30 minutes, so we're probably talking 20 to 30 minutes of each of these, and I'm just going to continue to come out with these videos because I have a list of these more that's included on here that I will begin to come out with and add them to them. So what kind of videos I'm talking about? I'm talking about how to, like for instance in the first one, the T3 titration guide, and what that means is how to take T3, what kind of dosages you need to start with, how to increase those dosages, how to add it to your existing medication. All of the type of nuances that I haven't talked about before on the blog, I include in here. Same thing goes for the NDT and how to titrate that, what kind of dosages you might expect to be on. I go into great detail on how to do that titration and how to get there, what your labs look like when you're up there, how to get those optimal labs, which labs are important, etc. The next one is, and I've never talked about this as well, is the GLP-1 agonist titration guide. So this includes how to get the best results, what kind of symptoms to watch out for, because this is the thing I've noticed. When I write about these things, a lot of you will come out and say, well, I've tried this and it didn't work. And it's not that the product didn't work, it's that it's that your physician didn't know how to properly use it. And every single one of these things, you see how much information is on my blog just about thyroid hormone. That same amount of information exists for each one of these medications. It's true for LDN, it's true for GLP-1 agonists, it's true for T3 titration and medications, it's true for NDT. So there's so much information that has to be given in order for you to actually understand. So more likely, it's not that your medication didn't work for you, it's much more likely that there was a misunderstanding in terms of how to use it, the frequency, when to take it, what to take it with, how to change thyroid dosing if you add these medications. All that stuff is included in these videos, and it's a lot of information, so it will need to be assimilated over time. Again, an LDN titration guide. This is specific for those with, I tell you exactly how I use it, but it can be used for weight loss, it can be used for autoimmune disease, it can be used for Hashimoto's, it can be used to reset the body set point, a number of other things. I talk about how to change. I'm going to do a video on how to change your diet so that it makes more sense to you guys. The kind of things that I'm thinking about when someone comes to me and they say, well, this is happening, or I have less energy but I'm losing weight, so what do I do? Those type of things are what's going to be answered in that video. How to use testosterone, estrogen, and progesterone. Who should use them? What to do if you gain weight while you're on those things? How to use testosterone to lose weight without, what do you do if you get symptoms? Things like that. I'm going to answer all those. How to use stimulants effectively. Again, I've never really talked about this before, but stimulants can be used effectively for weight loss if you know how to use them, but that's very nuanced, and we'll talk about that. And then, of course, lab testing and interpretation guides, etc. So again, I'm really, really, really excited about these videos. They will be out one a day, so even if you were to purchase the program today, these videos will be ready for you before the video ends. So, or I'm sorry, before your 60-day program ends. But again, really excited for those. So let's talk a little bit about frequently asked questions, because again, you're bound to get those. So I can hopefully answer them before, yeah, so you don't have to do any more digging for them. So first of all, will this work for me? This is a tough one, because I want to tell you that it will work for everybody, because I want to help as many people as I can. But I would be lying if I said that this had a 100% success rate. Right now, if you do everything that's included in there, the success rate's over 90, probably somewhere between 90 to 95%. So we're talking a very high success rate for a weight loss program, no question. However, there are going to be some people who are going to be more difficult, right? And those people that tend to be more difficult is anybody who's had bulimia or a history of bulimia or anorexia or any sort of eating disorder in the past, and people who have a complete thyroid removal. If you are one of those two people, your results I can't really predict. I'm just being honest with you, I can't really predict. If you just have Hashimoto's, if you just have hypothyroidism, if you have crazy high reverse T3 levels, if you have leptin resistance, if you have insulin resistance, if you have diabetes, if you have PCOS, and nothing else has worked for you thus far, this is probably still going to work for you. Most people come in and they're like, you don't understand, I'm going to be the most difficult patient you've ever had to lose weight, and 20 pounds later they're ecstatic. That's generally what it looks like for me. However, with the exception of those two people, the people with eating disorders in the past and the people with complete thyroid removals, those are the two groups of people that tend to be the most difficult for weight loss. Okay, so will it work for me? The chances are very high that it will, but if it doesn't, that's why, I have the refund policy, because if it doesn't work for you, I don't want you to have wasted your money. So you get a refund if it didn't work for you, and that's totally fine. I think that's very fair and appropriate, because I only want to try and help you if possible. And if I can't, then hopefully, then at least some of the information will be helpful for later on. So the next one, and this is really important, do I need medications or supplements? The answer is you don't need them, but they will boost your results. And so in the past, some people have said, can I buy these medications from you? I want these medicines. How do I get them? I can't give the medications to you. I can't sell them because I'm not a pharmacy. It doesn't work that way. You have to get a prescription from whoever your doctor is if you want to add them. But again, they're not necessary. It's only information that I've given you to help boost your results. Okay? Will you still get results without them? Yes. And so I just give you that information so you have it on hand so that you can use it if you decide that you want to. And not everyone does. People tend to like it to be more natural. Other people want to be as aggressive as possible. If you're on the aggressive as possible spectrum, guess what? All that information is there for you. If you're on the if you want to be as natural as possible and still lose weight, guess what? That information is there for you too. You get to pick and choose what you want to do. I give you everything as if you want to be the most aggressive patient ever, but I don't expect you to do that necessarily. I just want you to have all the information in case you do. And then guess what happens? If you want to start out and you're like, I want to be less aggressive, I want to do as natural as possible, and you get some results, but you're like, I want more, well, then just increase in how aggressive you want to be. Add more supplements, add more medications, do all these things. It's meant to be on a spectrum so that you can fit it to your needs. Okay, that's the design of the program. It's meant to be that way. Okay, what about vitamin injections is the next question. I do talk about some of the injections that can be used in the program to boost your results. Again, they're not necessary. Don't confuse the fact that just because I talk about them means that they're necessary and you have to have them. That's not true. I just include them in there because I want you to have as much information as possible. I want to arm you with this information so you can go to your doctor and ask for them. Now, the injectables are much easier to get than some of the other medications. But again, I tell you the dosages. I talk about how much to use, when to use them, how to use them around other medications, etc. That's all included in there. What's included? We did talk about that, so I'm not going to go over that in detail. The most exciting thing that I want to at least mention again here is that video series, which I'm really excited about doing. It's fun for me, and so I think you guys will find that really helpful. The next question is, do I need a doctor to help me? Again, you do not need a doctor to help you. The program was designed so that you can use this without physician supervision. That means just you, right? However, people get confused because they say, well, why do you talk about medications and injections then? And the reason I talk about it is because I want you to have that knowledge, but it doesn't mean it's required. It means it's there for you if you want it. If you don't want to use it, you don't have to. Okay, so do you need a doctor? No, you don't. But will you get some better results if you do, who's willing to work with you? Yeah, you probably will. And the reason for that is you're just being more aggressive. But it's on a spectrum. You can pick how aggressive or not you want to be. The next thing is, what if I live in a different country? So a lot of people have purchased this throughout the country in India, the UK, Australia, New Zealand, etc. And then, of course, the United States. But the question is, can I still do it if I live in a different country? Yes, absolutely you can. I've had people do it with great success in other countries. Now, one of the things is I can't control the medications that exist in other countries, or how to get them, or the injections, and sometimes some of the supplements, they're not always available. So just take that into account before you make the purchase. Not everything may be available for you to use, but the information is still there. But let me give you an example. So in Egypt, I know that you can just, and because I have lots of patients who come from Egypt, you can just go over the counter and buy medications. It's crazy. You don't even need a prescription. So with all this information, you can do a lot with it. So I'll just leave it at that. What if I have dietary preferences? We already kind of talked about that. So again, I can't account for every dietary preference that exists possibly in this world. So instead what I do is I provide you with information so that you can change it and adapt it to your specific needs. Okay, so that the information is included in there on how to adapt it. For instance, if you don't like whatever, let's say you don't like broccoli and there's a broccoli recipe. Okay, well just substitute out Brussels sprouts or something like that, or X vegetable that you prefer, right? It's pretty simple to do, and again, that's included in there. How much are the supplements? Depends on how aggressive you want to be. I would say anywhere from 1 to 200. But it's hard to say, and I would definitely recommend that you use the supplements each and every time you go through the program. The reason is because, you know, it'll probably provide a boost to your results, and most people want to be aggressive about their weight loss and want to lose more. The next question is, can I share the program? I would please ask that you do not. The reason is, and I get this question a lot, believe it or not, which is why it's on here, is somebody starts using it and they're like, you know, this is amazing, this has worked so well for me, can I give it to my friends and my family? And the reason I say not to share the program is not because I don't want them to share in your success. That's not why. The reason is because I want people who are interested, invested into the program, who understand exactly what they're getting to purchase the program. And the reason for that is because they'll have better results. You can have all the knowledge in the world, but if you give it to somebody who isn't ready to, number one, hear it, accept it, and assimilate it, then they're not going to get the results that you see. And that kind of can reflect poorly upon my program, because they'll say, well, I tried it and it didn't work. But they may not have tried it the way that was intended, or they didn't understand it, or whatever. So I just want, that's why. It has nothing to do with the cost. It has everything to do with all those things that I just mentioned. And then finally, how much does this program cost? The program, which is a digital program, which means it's emailed, the information is emailed to you, and then the videos are accessible on a special page on my website, which is shared with you privately, so it's not accessible to anyone else but you. The cost for that program is $97. Now, over time, as this program expands, and I constantly add more to it, like once I get to 20 plus hours of videos, for instance, that price is probably going to go up. The reason is because it gains value the more time and effort I put into it. So I just want you to be aware of that, but currently at the time of filming this, it's $97. Okay, so that was pretty much it. If you still have any questions, you know, you can feel free to email me at hello@restartmed.com if you feel like you have something that wasn't covered there. But that should cover most of the questions. And again, I'm really excited for you to embark on your journey of weight loss and to balance your hormones. And I really hope that this has been helpful for you. So that's pretty much it. And otherwise, I will talk to you guys soon. Bye.